Hi, hello, and welcome to Conversations and Connections with Malini, Dr. Roopa.
Hi, Gigi. How are you?
I'm good. I'm good. So you have been my dentist when I was in India, and now you have
Yeah,
moved to Dubai. Tell us about this journey of yours from India to Dubai, Roopa.
I was there. I was working in Chennai like right after my graduation for about say 6 years. And once I'm married, I'm here in Dubai. Like my husband was here, so I'm supposed to move here according to my parents. So I moved in here, and I'm practicing here as a dentist as well. Yeah.
How long have you been in Dubai?
In Dubai since 2014, and I was into operations and in the clinical side of dentistry as well. So fortunately, thank God, I have both the experience here in Dubai. Yeah.
So I've always known you, Roopa, as my dentist, Dr. Roopa, right? And then you went on to Dubai and you became a dentist there too. But today, this interview is not about you being a dentist. Today's interview is all about this volunteer work that you have done. Before we go on to that volunteer work, what I wanted to talk to you about is the COVID situation in Dubai. Could you give me a little brief about it?
Thank God the situation is really improving and it's progressing, because wherever I hear nowadays, it's all about discharging the guests or the positive persons. So that's a very positive news here. Nowadays, we should not say positive. Okay, so it's a very glad news. Nowadays, it's like improving here in Dubai. And yes, we do get positive cases also, but I think it is really good, like better than before, really better than before.
So there's a lot of recovery right now. Is that what you're trying to tell me?
Yeah, the recoveries are more, and the positive cases are very less compared to the last 2 months ago or something.
Dr. Rupa, you have done something that's really magnanimous. You are a dentist, but you had volunteered and gone down to ground zero. You had actually gone to an isolation ward, volunteered your services. How did you do that? Were you not afraid? What prompted you to do that?
I was actually very, very scared when I got this opportunity. But again, I should thank God, and I should thank my mentor, Dr. Rajkumar, who gave me this opportunity. But initially, I told him, I said I'll be coming. And then when I discussed this with my family, my mom, she was literally in tears. She said, like, no way you're going to this COVID duty. So I don't want to make her upset and do this. So I said no. But then when the opportunity came back to me again, I thought I should not miss this opportunity. I was actually scared. I still remember the day one of my COVID duty. I was like a kid going to her kindergarten class. I was really, really scared. But then, like, God was with me, my parents' blessings, and people like you. All your prayers were with me. So I did it. I think I did it very well, yes.
Right. And what did your husband say about you going to this camp?
Oh, my husband, he wanted to say yes just for my sake, but then he also had that hesitation in his mind. But
Right.
he never said no openly, but he had that no within him. And he said
Right.
yes just for my sake. And
Mhm.
finally, I convinced my mom also. She also said yes. And I mean, my sister, I should mention that my elder sister, Mrs. Deepa Armugam, she was literally down after hearing this, that I'm planning to go for this COVID duty. So she said, no way. I'm a person like I don't want to sit at home. I cannot sit at home. I'll go crazy if I sit at home. So that was the one thing I wanted to do, something outside. And I was sitting at home because we dentists are not allowed to practice any regular treatments in this COVID situation. So I told my sister that I can't sit at home. She said, like, see, it's going to be like a month or two. So try and think this as a break. But I said, I want to try this. She said a big no. And later I convinced her to. And finally, I got yes from all of them, all of my family members, and I made it.
I think what you did was magnanimous. I'm super, super proud of you. But before we can draw a conclusion, what's so magnanimous about it? I'm sure people want to know what did your volunteer work entail? The very first day that you went, what happened?
The first day I was all really like literally scared actually, and this is a complex where the Dubai government has arranged a beautiful setup for isolating all the guests. And the first thing, why I'm repeatedly calling them as guests is like because on my first day of my COVID duty, the first thing they instructed all of us is like we are supposed to call them guests and not patients. That motivated me, that gave me a confidence like yes, we gonna do this.
What were your duties? What did you have to do? So you
And
went in,
this
what
is
did
a
you see on the
complex.
first day when you went to that isolation place?
The first day when I entered the building, I was I mean again totally scared, and I was having many questions within me like what am I supposed to do here, and many questions. But then they give us the training, and apart from admin role, we also like I myself initiated a role like by myself, like I started counseling the guests in there, because counseling was a much needed thing for the guests in there, like who are isolated in one room and they're not supposed to come out. And so the counseling was also done by me apart from the admin role. So
Right. So you had direct contact with people who had been tested positive for COVID-19. So what were the protection gear that you used and how did you feel at that point?
we were having a triage in the ground floor where we are supposed to be there all the time, and my duty is about 12 hours in a day. It could be a day shift or could be a night shift, say 8 a.m. to 8 p.m. or 8 p.m. to 8 a.m. So we sit in the triage, and even sitting in the triage we need to like cover ourselves with all the protective gears like the surgical scrub and the mask. We always have triple mask. It's like the surgical mask N95 and one more surgical mask apart from that, like the head cap and everything. We were abundantly supplied by the government all these PPEs. We have never came across any shortage of any of the PPEs, let it be the shoe cover, let it be the head cap or whatever, like because every time we go meet any of the guests like who needs some assistance, like some might need to be their BP needs to be checked immediately, their glucose level needs to be checked immediately. For that we are provided the actual PPE along with the surgical scrub, the mask,
Mhm.
and the actual the white color like a jumpsuit thing. We wear
Yeah.
that, and it's always a triple layer. We protect ourselves in three different layers of the protective equipment, and then we visit them. Even for taking the blood, the glucose thing, we are supposed to accompany the nurse as well. Any doctor should accompany the nurse who's going to take the blood glucose level. So the
Right.
nurse should wear that, the doctor should wear that. Let
Did
it
you
be for
need
one
to?
patient or let it be for 1 minute. We are supposed to wear that and then immediately trash it out when we come off from there.
Wow, okay. Did you need to wear protective glasses as well? Did you need to wear
The
protective
face
glasses?
shield, the mask, and mask was again three layer of mask, like the regular mask and the N95 mask, which we are supposed to wear. And apart from that, the face shield as well. So it's very hard for us to even breathe. Like speaking is obviously going to be difficult, and even for the other person, the guest, it's going to be really difficult what we are speaking, because the speaking I felt that actually the speaking was actually very difficult, and even for them they couldn't hear us very well, so we are supposed to shout and talk, like the voice should be very high. That's when the other person, even the nurse who's accompanying us, they can hear us. So it's so much of protection, so we have to shout and talk so that that other person can hear.
So you said that was you even had difficulties breathing. You said, well, how did it feel inside three layers of protective gear? Did you feel hot? Were you able to move easily? What about at times when you had to drink water or eat? How was that all a challenge for you?
I can recall one incident like where I was supposed to go and take the physical presence of each and every guest. On that particular day, it was about 450 guests and three levels in the building. So I'm supposed to wear that and go meet in every guest and mark their. It's like an attendance sheet, like mark their physical presence in the sheet. So the ground level, I was like really okay, but then it was again difficult while talking. I should shout and talk, and it was very difficult for me. So my throat became very dry in the ground floor itself. So I had to cover up three more floors. I was like, I thought, let me take a break and then go back. But then I don't want to waste any of the PPEs which I'm wearing. So again, I have to trash them all. If I'm taking a break, I should trash them all and go to a new set of PPEs again. So I thought of taking a break, but I didn't do that. So I continued the first floor. I was like really tired. The thing is, yes, it's a centralized AC building. We have there's no stuffiness inside, but then like while walking, or I mean, it's totally protected. The face is like if we cover our face with a quilt and sleep, we cannot
Yeah.
sleep properly. We cannot breathe properly. So it's like that. So the first floor was done. I was literally shattered. I cannot even sit there because there's no place for other persons to sit there, like in any floor. We cannot do that. We should not do that. So I just stood there in the lift for say 2 minutes, and then I covered up two more floors. And I love challenges. It was really challenging that particular day, and this was my second day of the duty. I just motivated myself, and I thought I should do this, and I completed that particular task on that day.
Yeah. What was most fulfilling about this?
It's really satisfying. I mean, till date, I'm happy that I did that volunteer role because me as a dentist, it was all about the hi-fi treatments, cosmetic related dental health. And yes, we do take care of the dental health, but it's most on the cosmetic side of health. So this role was really, really satisfying for me. As a healthcare professional, I achieved something. So I used to, text my mentor, the other person who recruited me there. I thank them like at least weekly once for giving me this role, especially when I counsel the patient, the guest, and the next day when I check on them, they'll be literally happy because these guests are like really away from their families, and most of them like they don't even like reveal this particular news that they are COVID positive to their family members all the way
Hmm.
in another country, in their home country. So that's when I got to know this, that's when I initiated the counseling part of my role. And so whenever I counsel them and whenever I check them the next day, they feel very happy, and I create a rapport between a person whoever felt so down one day. So when I check with them and they thank me, so I really feel happy. I felt happy on that day. Like,
Okay, so this is the most fulfilling part that you said. Have you ever seen the worst case scenario when you were volunteering?
yes, that's the again. I should gear up myself to take up those situations as well, because there were many situations, and not just in our building, many buildings in that particular complex, especially elderly guests whose the blood glucose level was not in control. We are supposed to transfer them to the hospitals, and there are many situations like where we have to like witness some of the guests suffering the blood glucose cannot be maintained. So there are other kind of reactions. So kind of emergencies, if it is emergency, we are supposed to transfer them to the hospitals, and many emergencies. And main thing I would say is like some guests who felt very low, they also threaten us, saying by they want to commit suicide. something, they want to commit, they'll do something, and they want to just come out of the room. I mean, they want us to leave them, like, because they cannot stay within one room for many days. So I've come across those kind of cases as well, like people who were in tears. I mean, many elderly gentlemen, they cried. They were like, leave me, let me go, I'm okay. That's what they tell us. They cannot take, they cannot take that they are positive, that they are COVID positive, and they were on tears. And I mean, not just me, team of doctors and nurses, we try talk to them like in their own language, because it was a multicultural situation. Like there were many, like persons from different parts of India, not just India, from different parts of the world. So we try and talk to them in their own language, calm them down, and that was for the persons who felt emotionally low, and who want to do something and get rid of the situation. That is for them. But the medical emergencies was again heart wrenching, because I cannot see persons suffering, or like, I'm little weak at heart when in that kind of situation. Yes, I'm a doctor, I'm not supposed to be that way, but then, like, I cannot take up, especially an elderly gentleman. We have to shift them, like, there's no waiting time. uh, there's nothing like, let's wait till the day comes, or we can wait for 1 hour. No, we have to immediately call the ambulance and immediately shift them.
Right.
So that was really heart wrenching.
And what was the kind of treatment that was given to these people in isolation when they are already tested positive? Were there any medication given, any antibiotics? What was the treatment course?
So the government has set up a team of doctors where they will be prescribing the medicines for all of the guests in there. So apart from their usual chronic medications, that was also supplied by the government. That's again a big thing. If a person is diabetic, if a person is hypertensive, their usual chronic medications were supplied. And apart from that, the symptom related medicines were also supplied. Like, if there is a cough, or if there is a running nose, or maybe like high temperature, those symptom related medicines were also given. So they
So,
were taken care very well by the government and the doctors, the team there.
so the prognosis was done by a team of doctors, and then you had nurses who would go and give them the medication on time. And so it was just like a hospital setup, but instead of being in a hospital, they were the guests in this isolation place, correct?
That's right. That's exactly right. Right.
And at the end of the day, so what time do you start work and what time do you end your volunteer work?
There is a roster for all the doctors and nurses. It's basically a 12-hour shift. It could be from 8 in the morning to 8 till in the evening. And that's the time given, but it goes till up to 9 p.m., 9:30 p.m., because we finish our thing, the duty, and then hand it over to the next set of team who takes over. So it could be 8 p.m. to 8 a.m., or could be night shift, or could be day shift. Like, it goes according to the roster.
So at the end of the day, when you finish work, what do? You get rid of all the scrub, you get rid of the protective gear. What do you do?
So that's the main part, because I was all the doctors, all the nurses were given accommodation there, but I didn't choose the accommodation given by them. So I want to come home, visit my family. At least that will motivate me, that will push me to go ahead with the next day. After duty, I take at least half an hour in the building itself to make myself ready, because I'm coming home. I was really cautious after removing the PPE and everything. Like, I wash my hands, and we wash our face, hands. Like, at least I do it like at least 5 times once the duty is over. And when I come back home, the 1 more hour takes. I just stand outside, and fortunately, thank God, my mummy is here with me this time. So there is one washroom really near the entrance. So I used that, and I told my mom and my husband not to use that washroom, and I actually took that, and I don't even enter the house. I directly go to the washroom, so everything will be kept ready. So I take 1 hour, and then even then I'll have that fear, like, what if I'm a carrier? So that was there always in my mind. How many times I wash my hand, how many times I take a shower after the duty, or I always had that in my mind. Like, I started silently started praying myself, like I've never done that, like, praying all the time. Usually we have that particular time, like that praying time. I pray that time and I go ahead with my daily duties. But this duty taught me that I was silently praying to myself that nothing wrong should happen for anybody. Just because I want to give this COVID duty a try, not at the cost of my family. So
Right.
I was really, really scared each and every day. Not scared. The third day, I became very normal. Then I had that thought in mind that I should not be a carrier, because we are coming in the transport, and after the transport, this duty was in Dubai, and I reside in Sharjah. So I'll get dropped in Dubai. So from there, it takes at least 2 minutes of drive from Dubai, this dropping spot, to my residence. So I take a taxi and I come here. I mean, reach my home. So anyway, not just my family, I should not be a carrier for anywhere, like wherever I go. So, and I also restricted myself by going for shopping and all, or not shopping, the grocery shopping. Nowadays the normal shopping is not happening, but then
Mhm.
the grocery shopping or the vegetables and all, I didn't go till I was doing this duty. So
And so you said that the most fulfilling thing is that I think it's really magnanimous because Rupa, I've known you. We started this relationship, the both of us, as Dr. Rupa and me, your patient, when I came and visited you in your dentist clinic. And it has developed into a situation where we've become friends. I've become friends with most of my doctors. So so and then it's so heartwarming when you told me that you're going to volunteer. I had my apprehensions, I had anxiety, but you did it, and you've received a certificate from them to say thank you for the services that you've done. You've been with them for almost a month, and I'm very, very proud of you. And I think what you did was magnanimous, and we want to thank you, all these frontline people who are there fighting COVID pandemic. We can be at home, we can be praying, but you are the real life heroes, and I'm really, really happy that you have done this for the people in general. I'm very proud of you, Dr. Rupa, and my little sister. Thank you so much for joining me on this show. Is there anything you want to advise people who have got mild COVID symptoms? What should they do? Should they start panicking? What is your advice?
actually, I should thank you, Chechi, because when I got this opportunity, apart from telling my family, the only person I told is you. I told you on my third or fourth day of my duty, because the first 2 days I was not in the mood to, like, I wanted to give it a try. If it is really a big thing, I want to drop it. That was my mindset when I started my duty. But then I started liking it, and when I started enjoying, so that's when I told you that I'm doing this. So I should thank you for motivating me. You were also one of the part of my motivation. I always say that. My daddy usually say, be bold and courageous in whatever you do and fear nothing. So I kept those words in my mind, and that's when I pushed myself to do this COVID duty. So I should thank my daddy and mummy for giving me that strength, and I did this duty for them, and I'm satisfied now. I'm really, really satisfied that I did this COVID duty. One point I want to share about this COVID situation is including myself. I should say this to myself as well. Like, we should be calm. That's the main role. instead of getting stressed out, or instead of because I'm hearing lots of news, like whenever I open any of the social media platforms, there are many news happening. So I would request all of them, like it should be a calm situation. Yes, if it is positive, yes, it has happened, and we should stay calm and face it. Obviously we're gonna get recovered for sure. I'm sure about it. Like that strength should be there. Like instead of fearing, or instead of I should not say fear. Instead of that, like we usually say, "Why to me?" I mean, that should not be the question to yourself. Everybody should be bold and just stay calm. It's gonna end in a positive note.
Thank you. Thank you so much for being a real life hero, Dr. Rupa. And thank you for this time with us.
Thank you, Chechi. Thanks for this wonderful opportunity, and I love being part of your this program initiative. I should thank you for the motivation and the energy you're spreading all over the world through your channel and through your social media platforms. Thanks for that positive energy. I should thank you.
It's a pleasure having you. And thanks for joining Conversations and Connections with Malini. Thank you. Bye-bye.